Can I call upon Albert Cooksey? Albert?
Yes, I'm here, but I think I'm upside down.
Wonderful. I am delighted to invite you, Albert. For the rest of the attendees on the call or the conference today, he is the Senior Vice President and General Manager of 3PL Services at ICS, a very remarkable division of AmerisourceBergen. What has impressed me so much about Albert over the last several years is his focus, commitment to integrity and accountability in the specialty logistics business. And frankly, as we have heard all morning today, that is one of the typical requirements, one of the formidable requirements for the supply chain to be invincible, reliable. So here is Albert addressing a topic we talked about superficially all day long: labeling, packaging, and cold chain operations for cell and gene therapy. Albert, please.
Yep. Hopefully everyone can hear me and see my screen.
Sir, we can, loud and clear.
All right, thank you. I don't know what's going on with my camera. I was upside down, so I'll just cut that off to alleviate any distractions. Thank you. I know we were running a little short on time, so there are a couple of slides I'll probably skip.
No, please go ahead with the whole thing. I'll cut my last piece off, so I'm fine.
Okay. All right, good stuff. Once again, I'm Albert Cooksey, Senior Vice President and General Manager for our 3PL Services Group over at AmerisourceBergen. So really, I mainly focus in conjunction with our World Courier team and obviously 3PL Services. So this is something that we have been working on for some time. So there is a component that a lot of you probably are familiar with on the World Courier side, which is more focused around clinical distribution, while ICS is really focused on the commercial space. But as we're merging those two opportunities together, ICS will start to maybe have some opportunities to support storage from a clinical perspective, and then bring World Courier into play with where it's the right choice for commercial distribution as well. So very happy to be here today. Always happy to get the intros by Devendra. I almost want to hire him as my personal intro guy. So here, I think we talked a lot about this today. Cell and gene therapies, obviously life extending curative therapies, unbelievable technology. But at the end of the day, it's really, I think it was mentioned earlier, but in the very first session by Eileen, that for this particular therapy set, logistics is up front and foremost. So obviously all the challenges that I've heard different speakers talk about today, those are things that we are definitely trying to solve and deal with here at the supply chain level. And some of those things we're able to get past pretty good. And then there's other ones that obviously, as you're dealing with multiple partners and things of that nature, there's still what I would say work to do. Now here, we've listed a couple of different areas, autologous versus allogeneic. I won't spend a lot of time in the first two categories, medical advantages or availability challenges. I think that's been covered extremely well. And obviously that's not my area of expertise, but what I will do is jump down to the lower boxes there. Some of the logistics challenges, reaching limitations. And that is such a broad statement because it can mean a lot of different things these days. I think I heard someone mention earlier about the fact that the number of doors and things of that nature within the hospitals and the capacity there. Basically now with COVID, you're looking at capacity for air freight and things of that nature. So there's all these other variables that this particular therapy set really presents different challenges, and obviously making sure that there's enough doors and things of that nature for the actual transported product. Short shelf life, we talked about that earlier. Obviously that's a challenge, and sometimes we're talking not days, but hours in these therapies to get them delivered, whether it's to manufacturing or to the patient. So basically that's one of those scenarios where everything has to go perfect. Expanding shelf life, this goes a little bit to the earlier statement around the fact that these therapies have to be kept in a cryopreserved condition. So therefore, if the facility itself doesn't have those type of freezers, then a lot of times the doer is expected to be that holding tank for that particular therapy for some period of time, and obviously that can extend based off the requirements of the manufacturer. And then in the autologous world, I think it's been well documented where really you're talking about handling the product, to what I would say complete times, and the fact that whether you're the leukapheresis or apheresis process where you're collecting the sample, and then having to obviously take that to the manufacturing site, and then from there, from a logistics standpoint, replicate that and then send the therapy to the patient, and then go through the protocols that are required by the hospitals and things of that nature to ensure that product gets delivered on time, but more importantly, gets directed to the correct part of the facility so the patient gets the therapy on time. And then traceability, and this really goes to what we were talking about here. This is a patient-specific therapy. So obviously the chain of custody components of this are paramount across the board. So a lot of times you're talking about marrying patient services information along with logistics services information, and then making sure that those things get to the hospital correctly so therapy can get where it should on time. If you look over on the allogeneic side, some of those same exact components there, but one of the big differences there is that there is a storage component that could be possible in the commercial standpoint for allogeneic. So that meaning that from ICS perspective, just to give you as an example, we have invested in cryo storage tanks, and we'll talk a little bit about that later, but really giving us an opportunity to bring those therapies, which can be produced in larger batches, to actually a holding facility, a commercial grade holding facility like we have at ICS. And then at that point, we can distribute those therapies according to the different regulations or guidance of the manufacturers. One of the other components that we'll also have to deal with in the allogeneic spaces is serialization. So I'll talk a little bit about that later, but that was a puzzle that we've invested some time in, and really making sure that we have options for the manufacturers as you go through and evaluate how are you going to get this product compliantly to the hospital space, since this is a different requirement than from the autologous. Won't spend a lot of time here. I'm pretty sure everyone on this call has seen some version of this particular diagram, but basically, long story short here, the autologous, where we talked about the multiple different nodes as far as apheresis, leukapheresis, the collection to the manufacturer, and then directly to the patient. And then, like I just mentioned before, where we actually have the storage capabilities, getting larger batches from the manufacturer, storing those, and then obviously sending those to the patient, or if there's some different type of other research facility that's required at that point, then we can transition those materials over to that institution there. Now here, we just want to really talk about what does it take for a logistics platform. I think the thing that's been exciting as I've been listening to this, and I will admit there were definitely many phrases that went way over my head. It's amazing the intelligence level of people that we have in this space. So kudos and my hat's off to you there. But I think the main thing that everyone was really talking about was the partnership. This particular therapy line is definitely going to require that. And you'll see me talk about some strategic partnerships that we have made, even as World Courier ICS and even as AB, and we'll talk a little bit about that down the line. But here, really, a single partner for phase 1, 2, 3 for commercialization. And what we're trying to look at there is that obviously in some of these therapies, if there's opportunities to provide a clinical platform for storage where we're allowed, and then you can transition some of those same services over into the commercial space. A lot of times when you start talking about handling of the product, the different transportation requirements, if all that and that expertise can be built by an organization that you can work and partner with as you go from clinical to commercial, we definitely see value in that. Global locations. We've talked about that, where there's study sites, and then there may be commercialization aspirations globally for these particular products, or there just may be patients globally, and being able to support those different requirements globally is definitely a component of this, and we'll touch on that as well. The specialized packaging, I think we've talked through that as well, but there's obviously multiple options from a cryo perspective, and there's a couple alternative LN2 alternatives out there as well to transport materials. So, but that takes infrastructure, and then it also takes the data network to be able to make sure that those things, whichever type of transportation or whichever type of door that you do choose to transport your material, you have to make sure that you're working with someone that has the network, because unfortunately everything doesn't go perfect, but there's different requirements. There's ad hoc requests that may come. There's opportunities where you may not have the lead time that you were normally wanting for a particular therapy, and you may need to secure a door and a shipment faster than anticipated. The other piece that I've heard talked about, which is extremely important, is data access and analysis and oversight. So really having visibility to this product all the way through the supply chain. There are components in the patient services arena and insurance arena that actually may dictate when some of these therapies may be administered, invoiced, all those different types of things, which on the back end may feed into some type of service offering that we may be able to support, or nevertheless, just to ensure that you still have the proper visibility as those things that are required as part of the whole patient therapy, that you have the ability to know exactly when those happen and have that information at your fingertips. Now here, just wanted to provide this map, and this is not to be taken as here's our infrastructure, but what I do want everyone to take from this is that this is where we have invested and we are going to continue to invest. And I wanted to show this to say that, you know, as an industry, obviously there's going to have to be more green dots on this particular global map for this to be successful. So obviously we have partners in the space. We have, you know, in other institutions just like AmerisourceBergen that are investing in this technology. But nevertheless, this is a start, and I can't emphasize that enough, that we're looking to expand, but I also know that business partners will be looking to expand. And I think it's going to be required if you really look at the therapies that are in the pipeline and the global requirements for many of those therapies. Now, from a AmerisourceBergen perspective, we did our homework, and we wanted to look at different technologies out there that we were not necessarily investing for, you know, the therapies that are going to hit the space in 2022, 2023. We were looking for what's going to happen, what type of infrastructure will we need to support a more expansive therapy set. And really for us, the Brooks cryo tanks, they really fit the bill for us. There's a couple of things that we're looking for to ensure that we can pass along to clients. First of all, dependability, number one, obviously that being a validated system, number two, and then our ability to be able to expand this particular physical infrastructure, and also the ability to operate that at a very, very high level of accuracy. Those are things that worked out well for us as we were looking into which cryo tank that we were bringing into our facility. So we do have these tanks in our facility today. They're active. Then we also have the other component of this is that we've always been talking about data. So this actually gives us the opportunity to be able to integrate the inventory level data into our ERP system. So that way we can connect all the information together, and then obviously we can send that downstream to whoever it need be. And like I say, in this space here, there are a lot of individuals that need this type of information at every stop of the leg for these therapies. One of the other components, and I mentioned a little bit earlier, and that's really around serialization. And I know for those of you in the industry with other molecules outside of the cell and gene, you've definitely heard the mandates for serialization obviously coming up quickly in 2022 and widespread in 2023 if those timelines stay consistent. Well, along with that, some of those requirements will fit the bill for allogeneic therapies. We've made the investment early on to go through the research to understand how to condition the cartons, the adhesive labels that would be required in this particular situation to add a serial number, and then take the vial, place it in a serialized carton, and then obviously inventory that as well. So as one of the requirements for distribution in the future, that serialization component will be required as well in the allogeneic space there as well. So that is something that is going to be relatively new to a lot of our partners out there, relatively new to even our space, but we've made that investment, and that's something that a lot of times we want to do. So definitely sitting in a good position that as that requirement is required, we can be able to take that information and pass along. And then there's other vendors that we have to partner with as well that allows you to meet some of the global requirements from a serialization perspective. But you have to start with a very solid platform. And more importantly, even as rudimentary as it sounds, you have to start with the ability to actually place that serial number on a carton and then place that vial in there as well, and then inventory it correctly. So that is definitely a different feature that we will see in some situations in the allogeneic space. Now here, just kind of putting out a couple of dual choices. Obviously, there's other choices out here. I'm not here to promote one over the other. Mainly here is just talking about options. And once again, you have to partner with these organizations to make sure that they meet all the requirements that you are looking for from a manufacturer. And then we as a logistics organization, you have to make sure that they meet the requirements for us for performance. But more importantly, they have to be able to provide the data sets that are required by us that we can pass on to manufacturing partners and obviously patient service organizations who, obviously need this information to effectively apply the therapies. So here, there's the VIA capsule, which is an LN2 free technology that you charge electronically. So that's an option out there today, relatively new. The SAVSU units, and for those of you that are out there are probably very familiar with that, built-in tracking, tilt management, which is a requirement for some therapies. And then obviously the palletized, which is a very widely used solution there as well to keep from tilt and turning over. So there's just a couple of different doers that we have, within our network. And obviously a lot of times I'm working with manufacturers. I think someone mentioned earlier where we start talking about the SOPs and protocols. This is where it starts. Exactly how do you want it packed? What is the protocol? Because once we actually deliver these particular units to a facility, where does it go? Who's authorized to actually check the unit in? And then at that point, the protocols for moving the therapy if they have an alternative storage solution there as well. And once again, we talked about kind of the, for lack of better terms, the number of dots, on the map and how they will need to increase to be able to support these therapies over time. This here is just a quick synopsis of the different areas where we have the ability to either charge the VIA capsules or we have the ability to recharge, meaning add additional LN2 to doers as they go through the transportation process. And that's where the tracking and information and understanding if there's delays in the process, because first of all, we're trying to make sure that we get the therapy there as fast as possible for the patient, but also if there is some type of delay, we want to have the ability to recharge that, keep the temperature there and save the product, especially when you start talking about an autologous type of situation. So this is just kind of our map of where our ability to be able to support these different components, whether it's charging LN2 or charging some of the VIA shippers. Access for data and insight, I talked a little bit about that earlier. This is where we're really marrying for us. We know a lot of times we have to get this information to manufacturers, to patient service organizations as well. And then for any other type of service organization, it may be an ICS as a 3PL, that maybe we're the one that's aggregating some of this data and using that to pass on to the manufacturer the bits and pieces that they need to update their systems with as well. But nevertheless, data is paramount as part of this system. And this is one of the things that we spend a lot of time and a lot of investments in as well. The last slide I want to show here, and I think we've talked about a lot, where partnership is paramount. You'll probably have seen some stuff in the press where we have done some things explicitly with TrackCell, which is an organization that's working for supply chain visibility, and then rolling that type of information and discipline over into the commercial area. Benetti has the same type of platform as well, but really helping manufacturers automate some of those process procedures, but more importantly, setting themselves up to roll that into a commercialization setting as well. And the good thing about the fact that we're partnering with these organizations early, we're taking a lot of feedback from the manufacturers, what it is they want to see, what it is that's needed, that once they do go commercial, these are the type of things that'll happen. So obviously the commercial environment adds a little more uncertainty as far as maybe scheduling, patient readiness and things of that nature. So in the commercial organization has to be a little bit more fluid. So what does that look like that's not a controlled clinical environment? So as you see here, all these partners are key. We're integrated, whether it's from a data perspective or just procedural perspective many times. So when you talk about ICS and our ability to store cryo, when we work with the SOPs, it's not just, even though World Courier, we're part of one organization, we work together very closely, but we also have to do that with Mark, and we also have to do that with QuickStat as well, to make sure that the process and procedures are understood. So when those individuals come into our facility, we want to make sure that we're providing that service, because at the end of the day, we all understand the time sensitivity that's really associated with these therapies, and more importantly, the patient at the end of the day, making sure they get them on time, obviously, because there's some things they have to do before they can receive these therapies. So I can't express enough, and it's been great to hear this across the board, and obviously there's going to be more dialogue needed. The one part that I did not have on here that's important, and I heard it mentioned multiple times, is we do have some work streams as our organization that we've worked with other consulting companies and other partners, where we're really trying to figure out what can we do to simplify the process at the health system level. Obviously, they have multiple portals that they're using today on the commercial side, where they have to put in multiple pieces of demographic information, and obviously some of these dosing regimens are based off of that. And then from there, if they have another therapy, they have to go to another portal. So what can we do as individuals, as leaders in this industry, to kind of create a clearer path for the health system? So that's not going to be a project that AmerisourceBergen can do in a vacuum. It's not going to be a project that Traxel does or Cardinal McKesson. It's really going to have to be something that we all come together and kind of understand. Platforms may be a tad bit different here and there depending on wholesaler or Traxel Vernetti, but the core components of them being able to consolidate information and use that, I think, is definitely going to be a requirement for the health systems, because I think the reference, the term was made, there's one of us, many of you, and unfortunately with these therapies being so sensitive time-wise, they have to have the ability to process, place orders very quickly. So that is another work stream that we didn't really detail here. That could be a whole different category in itself. So with that being said, just wanted to provide that and want to see if there was any questions.
I just wanted to be very spontaneous and let you know that you have helped us wrap up this event with a tremendous amount of comfort, because you've shown us very comprehensively, in a very practical manner, how the Achilles heel, as I call it, of the supply chain, meaning labeling, packaging, and temperature control distribution, can be handled, can be confronted. You demonstrated it can be. And I really am very grateful to you for enabling that understanding on all our part. Finally,